We just got back from a shelter tour, and three things stood out to me: the impact of no kill as it's understood by the public, the warehousing of animals, and the ongoing impact of the pandemic. The no kill label has clearly influenced how shelters intake and manage the shelter population. We met dogs who had been in shelter care for years and some who had grown up in it. Many of these dogs exhibited clear shelter stress, spinning, excessive barrier aggression, cowering, weight loss, and worse. In some places, the dogs had less than 30 minutes out of their kennels each day. Some were living in crates, and some had no human contact beyond staff moving them out to clean or to feed them. In shelter and rescue language, this is called warehousing. And while some dogs can be warehoused for years and survive physically and even somewhat mentally intact, it is not a life that I would wish on any dog, no matter how resilient they are. To my mind, this is keeping an animal alive. It is not sheltering. There's a big difference. The people we met, every one of them, care deeply and passionately about saving lives. They don't want to euthanize for space or length of stay. And I never imagined I'd say this, but I don't believe we can adopt our way out of this crisis. That time was 6 years ago when we were still on the road to it. Two shelter directors asked me, what happened during the pandemic that changed everything? Well, a lot. Before the pandemic, when we visited shelters, we saw a lot of evidence that the animal crisis was improving. Now, on every tour, we see it worsening. Why? Spay and neuter availability and affordability disappeared in many places due to demand for services, a veterinary shortage, and the private equity acquisitions of many veterinary practices. Finding affordable housing, let alone pet-friendly housing, became harder than ever. During and after the pandemic, rental housing was often improved, and once eviction moratoriums were lifted, people lost their homes because the rules changed. Everyone wanted a puppy during the pandemic. Remember that? Breeders quickly sold out and backyard breeding exploded. Puppy mills cranked up production. Everyone wanted to make money on the massive demand for puppies. Puppies were often not spayed or neutered, and maybe those surgeries didn't happen because the veterinarian had paused services as non-essential during the pandemic, and that created a backlog along with the surge in puppy purchases, leading to higher prices, fewer surgery slots, and the deprioritization of spay and neuter for shelters and rescues. They are typically discounted, so often are lower on the priorities. An unprecedented number of dogs were also adopted during the pandemic, many by first-time adopters who lacked the knowledge or the experience to properly socialize, train, manage, or follow health protocols, including spay and neuter. And then there's the insurance companies. They continued and in some cases expanded their restrictions on coverage for families owning bully breeds and aggressive breeds. For all of those reasons, the numbers of owner-surrendered animals increased, as well as intentional and unintentional litters. Hoarding cases have also increased during this time. But nothing affected the animal crisis like the increased practice of managed intake and the introduction of community sheltering. Managed intake was pushed by national organizations that define no-kill as 90% live outcomes. Note, I have to say this, nowhere in the original tenets of no-kill will you find 90% mentioned. In an effort to earn this no-kill status, and with it the public support, grant money, and accolades from national organizations, shelters began to or increased their practice of managed intake. Managed intake means just that. You manage which dogs come in and which dogs don't come in. If you are full, you refuse to owner-surrendered dogs, and you might even refuse strays. You put people on waiting lists. These lists grow long. We visited a shelter last year whose waiting list had more than 300 families waiting to surrender their dogs. Managed intake looks great on paper. You don't have to euthanize a dog you've never allowed in your building. For many of the reasons I've mentioned, adoptions stalled and rescues pulled fewer dogs as they were also full and or protecting their no-kill status. This led to dogs being warehoused for months and years. They are alive. They have not been killed to make room. But are they living? More than one director on this tour told me that euthanizing dogs they'd had in their care for months or years would be impossible because it would devastate their volunteers. And that's an understandable concern, but one that can and should be met with transparency. If no one in the community has chosen to take this dog home and no rescue has offered to pull it in all this time, that dog is not adoptable. And more importantly, it is taking resources and space away from dozens of dogs who are suffering and dying, not to mention multiplying, outside of the shelter. I don't begin to presume this is an easy conversation, but it's one that needs to happen. Community sheltering is another new policy that came about during the pandemic. It was pushed out by several national organizations and promoted that communities take responsibility for their lost animals. That's assuming that all the animals that are loose and roaming are lost. And that assumes that they are about a mile from their home, which is possible if they're truly lost. They recommended that finders leave the animals where they were found and or foster the dogs and cats themselves and look for the owners or a new home. So much is wrong with this assumption and these instructions that my head practically explodes when I think about it. First of all, many found animals are not lost, they are abandoned. And now remember the effect of managed intake, right? No owner surrendered or sometimes stray animals can come in if there isn't room. And guess what happens to animals who people won't or can't continue to care for? They get dumped. And 80% of animals coming into shelters are not altered. So those dumped animals multiply quickly, especially if they're just left where they were found. Even if that animal is truly lost, as a longtime foster mom, I believe it's dangerous and irresponsible to advise people to take in an unknown dog with no experience, no support, and no plan for that dog's outcome. I would never foster a dog without knowing its health record. I have dogs of my own and I won't put them in harm's way. And I would never foster a dog that a professional hasn't handled and assessed, or at least at minimum for behavior. What's truly amazing to me is that there haven't been lawsuits brought on by people advised by their municipal shelter to foster an animal or leave it where they found it, only for that situation to take a tragic turn. Things have changed in the animal shelter world since the pandemic. And because of that, we need new solutions. Defining no-kill as 90% live outcomes is not just wrong. It has incentivized behaviors that are driving our animal crisis. Every day that we don't address this, we dig ourselves deeper. And ultimately, every community will reach a tipping point. And when that happens, I cannot even begin to imagine how far we will be from the fictional no-kill nation everyone assumes we are becoming. It's time for people to speak up, ask questions. What kind of life is it for a dog being warehoused for months or years? What happens to the dogs who are turned away because there is no room? There are fates much, much worse than a humane euthanasia. None of this is easy, but here's the bottom line. If we don't face up to it now, we will only make the crisis worse. And in the end, more animals and more people will suffer because of it. Hey, we have traveled, we've made over 200 visits now to shelters and rescues in 17 states, and we welcome your ideas and your thoughts about the animal crisis and how we solve it. You can reach out via all our social media channels or visit our website, whowillletthedogsout.org.